So our second discussion today continues some of the themes that Dr. Quiroz and Susan Ann Koviak introduced. They talked about brain health recommendations, and they also mentioned some of those brain health recommendations are difficult to put into practice. And some of them really need all of us to work together as a community, or they need policymakers to make changes because they're not things that individuals can necessarily change themselves. Our second conversation is really connecting that dot to what we call the social determinants of brain health. And I'm going to be introducing 10 individuals, so we can't have everybody on screen at once, but all of these individuals will be sharing their wisdom. First, Andrea DeTore will share some slides to help us understand the concept of social determinants of brain health. Andrea serves as Healthy Aging Director at the Boston Public Health Commission, and she's part of a team that leads the Boston BOLD project. BOLD is a public health initiative to really make a huge impact in the area of dementia, and Andrea will tell us more about that. And then we have 9 individuals who do many different things, but one of the things that they do is to serve as Dementia Friends Massachusetts community partners, which means that they lead Dementia Friends workshops in their community. And they will be talking with us, really sharing a voice and a perspective from their community. I will go through their names right now. Kun Chang is the Associate Director of the Greater Boston Chinese Golden Age Center. And he is President of the Chinese Folk Art Workshop and Project Director of the National Asian Pacific Center on Aging, and he has served in those roles for over 2 decades. Alana Dundon is a Dementia Friends champion and community partner, and before emigrating to the US from Brazil, Alana worked as a psychologist, organizational consultant, and in human resources. And she also brings a personal experience as a longtime caregiver for a family member who lived with dementia. Arnetta E. Ferguson is a Dementia Friends champion and community partner. And in addition, she is a senior instructor and trainer for Tech Goes Home, which is a digital equity program. And she has also served as a Healthy Neighborhood Study resident researcher and coordinator. Dr. Doris Harris has a consulting firm, Harris Resources, which specializes in quantitative and qualitative research methods. And she hosts the Health Matters radio show and is health editor of Point of View, a newspaper, and facilitates a memory cafe. And she's co-chair of the Black Springfield Health and Wellness Coalition. Lisa Krinsky, you just met, who is director of the LGBTQIA+ Aging Project, a program of Fenway Health in Boston. Tirsa Ramirez is a patient navigator and health educator at the Latino Health Insurance Program and is pastor and leader of women's ministry for a church serving the Spanish-speaking community. Reverend Dr. Sandy Range has over 24 years in private psychotherapy practice as a trauma specialist and certified hypnotherapist. She is a Tsalagi medicine elder and initiated Kiro shaman and ancestral lineage healing practitioner. For over 40 years as a Reiki master, meditation teacher, therapeutic life and wellness coach, and Dr. Range founded Grandmother's Village Project to create a low and moderate income, eco-sustainable supportive housing village for elders of color and other marginalized populations. Kathy Service has worked in the field of intellectual and developmental disabilities, or IDD, since 1976 as a nurse and nurse practitioner, and was one of the first nurses nationally to be certified in the specialty of developmental disabilities nursing. She serves on the National Task Group on Dementia and Intellectual Disabilities, among many other roles. And you have met Judith Thermidor, who directs the East Boston Council on Aging. That is a very diverse community here in the Boston area with many immigrant communities. Prior to this, she worked in affordable housing, and her background includes training in medicine, advocacy, and global health delivery. So you are in good hands with this amazing group of people, and I am going to first bring up Andrea DeTorre's slides. And so Andrea, if you want to go ahead and let me just jump ahead. I'm sorry here. If you want to go ahead and unmute, I am just going to get to your slides. Here we are.
Awesome. Thank you, Beth. Hi, everybody. I'm really excited to be here today. Really grateful to Beth and the other speakers for being able to participate in this conversation. As Beth shared, I'm Andrea DeTorre. I'm the Healthy Aging Director for the Boston Public Health Commission. Today, I'll be talking about the social determinants of health and of brain health, and that will set up a conversation between the community partners who were just introduced from the Dementia Friends Network. Next slide. So really quickly, as far as our agenda goes, I'll briefly talk about the Boston Public Health Commission and what we do. I'll define and share some examples of the social determinants of health and of brain health. We'll talk about why dementia is a public health issue and how the field of public health is responding. I'll touch on some of the disparities that we see in the risk of dementia between different groups. And we'll end by talking about the connections between the social determinants of health and 4 of the main risk factors for dementia, which were referenced earlier: physical activity, managing chronic conditions, nutrition, and social isolation. Next slide. So to start, the Boston Public Health Commission is the local health department for the city of Boston. And you'll hear me refer to the commission as BPHC for short. We are an independent public agency with a board of health appointed by the mayor of Boston. We were founded in 1799 and we're one of the oldest health departments in the US. And our mission is to work in partnership with communities to protect and promote the health and well-being of all Boston residents, and especially those who are most impacted by racism and systemic inequities. Next slide. So BPHC operates through 6 bureaus and over a dozen programs that address health across the lifespan. And we like to say that we try to promote health anywhere that people live, work, learn, play, worship, or gather in community. And today I want to call out our Brain Health Initiative, which is the Boston Bold Project. This was launched in 2021 with funding from the CDC. And we're one of 43 state and local health departments across the country who are really trying to work in a coordinated way to build public health infrastructure in support of people living with Alzheimer's and dementia and their caregivers. And this is how we got connected to the Dementia Friends Network in Massachusetts. Excuse me. Next slide. So at BPHC, as in many health departments, we work to promote policies, systems, and programs that address the social determinants of health. And if you've never heard this phrase before today, the social determinants of health are the non-medical factors that affect people's health outcomes across their lifespan. These are things like education, access to healthcare and quality of healthcare. These are our neighborhoods and their built environment, economic stability, social and community context, and exposure to things like racism, homophobia, sexism, anti-immigrant discrimination, community violence, and interpersonal violence. And a really important point about social determinants of health is that they encompass policies, systems, and structures at the societal level. They shape people's lives and health outcomes from birth, and they influence our physical and our mental health long before we see signs of disease. And because we as a health department aim to improve health on the population level, we work to address social determinants as a powerful and really a necessary way to reduce people's risk of disease, including Alzheimer's and dementia. Next slide. So I really want to emphasize that the social determinants of health impact all aspects of health, including, and maybe especially, our brain health and our risk of dementia. And some social determinants have a particular influence on the health of our brains, and I'll mention a few here. Education is one social determinant, and we know that people without a high school diploma are likelier to experience cognitive decline. Access to healthcare is a major determinant. We know that without a source of primary care, we might struggle to manage chronic diseases that are dementia risk factors. These are diseases like hypertension, diabetes, high blood pressure. Without access to care, we're also less likely to have access to timely screening and diagnosis and treatment for dementia. And then there's the built environment. This is one thing we might not think often about, but it has a big impact on our brain health. We know that neighborhoods that lack green space, or that have air pollution, that aren't walkable, or that have poor access to transportation, this prevents us from being able to access nutritious food, to do physical activity, and from connecting with community, and all of those are vital for brain health. And then, as has been mentioned several times today, we know that loneliness and social isolation are really important determinants of brain health. And isolation and loneliness can also be shaped by the built environment and influenced by our identity, our connectedness to neighbors and family and community. So all of these social determinants and many more directly and indirectly influence the health of our brains and our risk of dementia as we age. Next slide. Okay, so we talked about social determinants. They're a big driver of dementia, and they're a big reason why Alzheimer's and dementia have become a public health issue. And again, just to quantify the scope of Alzheimer's and dementia in the US, as of this year, almost 7 million people in the US are living with Alzheimer's or another dementia, and this is projected to more than double by 2050. More than 11 million people provide unpaid care to someone living with Alzheimer's or dementia across the country, and we know that caregiving takes a major toll on individuals and families. So Alzheimer's and dementia has become a public health issue because the burden is so large and the impact is so great that it's really going to take a systemic societal level response to address this issue. Next slide. So it's also really important to emphasize that Alzheimer's and dementia are not distributed equally in our population. We see disparities among groups by race, ethnicity, sexual orientation, and gender identity, and among people living with disabilities. And this isn't a coincidence. Groups targeted by systemic racism and structural inequities, by prejudice and discrimination, aka people with poorer social determinants of health, tend to experience higher risk of Alzheimer's and other dementias. So some of the key disparities, which have also been referenced earlier today, but 2/3 of all people living with Alzheimer's are women. Black and African American adults over age 65 are twice as likely as white older adults to develop dementia. Hispanic and Latinx older adults are 1.5 times as likely. We know that American Indian and Alaska Native peoples are also likelier than white people to have dementia. And we know that people who identify as LGBTQIA+ are more likely to develop dementia than individuals outside of this community. And I also wanted to call out disparities impacting the intellectual and developmental disability community. There is a small genetic or increased genetic risk among people with Down syndrome for Alzheimer's and dementia. And the risk among all people with disabilities is about the same as the general public. but there are inequities and impediments to accessing healthcare, as well as prejudice, that do drive dementia risk among the IDD population, and that's worth noting. So another take-home point about Alzheimer's and dementia disparities is that, by and large, disparities are not rooted in genetics. Really, they align with other disparities in health outcomes and lifespan that we can attribute to inequities that stem from systemic racism and discrimination. So we see that social determinants, and particularly social context, drive dementia risk, and they also influence whether groups have access to screening, diagnosis, treatment, caregiver supports, and enrollment in research. Next slide. So in the face of this large and growing issue and these very stark disparities, what is being done? In the public health sector, Congress has worked closely with the Alzheimer's Association and a broad network of advocates over the past several decades to pass legislation and allocate federal funding for the public health response to Alzheimer's and dementia, and including addressing social determinants of health. Next slide. And I want to highlight some of the key legislative and policy efforts at the national level that are guiding the public health response to Alzheimer's and dementia. So one of those is the Healthy Brain Initiative Roadmap. And this is what guides BPHC and many state and local health departments that are working to address Alzheimer's and dementia in their communities. The roadmap includes strategies in 4 domains: policies and partnerships, workforce capacity, public education, and data surveillance. And an updated roadmap is released by the CDC every few years. And the CDC has also published a roadmap that has a special focus on Alzheimer's and dementia within American Indian communities. And the latest version of the roadmap has a special focus on equity and encourages health departments to address social determinants and health-related social needs through their Alzheimer's and dementia programs. Next slide. So another key legislative milestone is the National Alzheimer's Project Act. This was originally passed in 2011 and was just renewed earlier this month, but it led to the creation of a national plan to address Alzheimer's and other dementias. And the plan originally had 5 goals, but I want to call out that a 6th goal was added in 2021 to accelerate action to promote healthy aging and reduce risk factors for ADRD. And adding this 6th goal really encourages the federal agencies and the health departments that are working on Alzheimer's and dementia to double down on those upstream factors that drive dementia risk. And that includes social determinants of brain health. Next slide. And the last piece of legislation I wanted to call out is the Building Our Largest Dementia Infrastructure for Alzheimer's Act, or BOLD. And this is legislation passed in 2018, which authorized funding for state and local health departments like BPHC to receive grants for Alzheimer's and dementia programming. And BOLD provides us with the funding and the technical assistance that we need to advance national Alzheimer's plan goals in our local communities. And so with this BOLD funding, BPHC launched our Boston BOLD project in 2021. And through this initiative, we're working to reduce Alzheimer's and dementia among Boston's Black, African American, Hispanic, and Latinx residents who are at highest risk of dementia. Next slide. Okay, so we've talked about social determinants of health and brain health, and about legislation and how public health is organizing to have a coordinated response to Alzheimer's and dementia. But I want to bring it back to the social determinants. So as we heard earlier, there is evidence that embracing brain healthy behaviors and lifestyles can reduce our dementia risk. This is embracing things like good nutrition and regular physical activity, managing chronic diseases, and having strong social and community connections, all of which promote brain health. But I just want everyone to keep in mind, as others have made this point today, these modifiable risk factors are very much influenced by social determinants. And while there are many things that individuals can do to reduce their dementia risk, we must act at the level of community and societal policies if we want to eliminate inequities and make sure that individuals have what they need to choose brain healthy behaviors. And these include things like income and employment, transportation, access to nutritious food, a source of healthcare, and the knowledge and skills to make brain healthy choices. Next slide. And as we head into our conversation with the community partners, I also wanted to emphasize that the social determinants of health drive inequities and health disparities that affect people of color, Indigenous people, immigrants, LGBTQIA+ identifying people, and others who have been historically oppressed. And these populations should really be leading the way with the support of public health, infrastructure, and funding. And they should be setting the tone and leading the conversation in determining how we can collectively help reduce dementia risk and improve access to screening, diagnosis, and treatment. All of this is to say that people and culture matter, and that the panel we hear from next will explain the work that they're doing in community with residents and partners to address social determinants of brain health. Next slide. In summary, these are the key takeaways from this portion of the panel, but the social determinants of health are the social determinants of brain health. Inequities in the social determinants have led to dementia disparities for historically oppressed groups. To make a meaningful impact on the burden of dementia, we need to focus on reducing the risk and incidence of dementia among people of color, women, LGBTQIA people, and all who are impacted by inequities that lead to increased dementia risk. Addressing the social determinants of health can get us there, and community, culture, and collaboration are vital. So with that, I will turn it back over to Beth and the panel.
Thank you, Andrea. That's a very helpful framing and discussion about the social determinants of health. So just to summarize a little bit about some of the dots we've connected so far, we've heard that brain health research is giving us a lot of hope, is letting us know that up to 45% of cases of dementia, in theory, could be prevented by changing some of the ways that we live our lives. And yet it's very hard to do that. It's hard as individuals, but it's also hard as communities, and that some communities face greater barriers. We also are looking forward to a conversation later today with advocates who are living with dementia, who will talk to us about living well with dementia, because we know that's part of the flow here, is that we continue to need to focus on brain health and wellness even after a dementia diagnosis. So with that recap, I would love to have a conversation now with Andrea and our 9 Dementia Friends Massachusetts community partners. I'm going to encourage all of us to try to speak a little bit slowly. And we're going to focus on 4 areas: food and nutrition, physical activity, managing chronic health conditions, and social isolation. So these are kind of groups of brain health factors that are really important. So let's start with food and nutrition. When we talked about this as a group before, one of the themes that came out was lack of access to nutritional food. This is a barrier that some community partners have really recognized in the communities that they're serving. And I'm going to ask Alana to start. Alana, do you want to unmute and share a little bit about what you've seen in terms of challenges in the Brazilian community around access to nutritional food?
Yes, thank you, Beth. Well, I believe in Brazilian community. They work so hard. They work many hours, sometimes 7 days a week. And because of this, they don't have time to have a good meal. And they don't, most of them, they don't have a family here to give them some support. So they don't have time to cook health food even, you know. So what happened is they buy junk food. We have a lot of Brazilian restaurants and bakeries. The restaurants has some good foods that to provide a good health, but sometimes they don't have time and they get pastries, and these options are very fat or sugary, that what is not very good for health. So what I think is that problem, you know, we have, this is a big challenge in our community.
Thank you, Alana. So you're pointing out that there's a connection between how many hours people are working and being able to prepare healthier food. And there's also many other issues about access. I wonder if I could go to Arnetta E. Ferguson. I know you've worked with some urban farms and other resources to help people get access to healthy food. What kind of challenges do you see in the communities that you serve?
Good afternoon to everyone. Most of the challenges that I see in the community in which I live are mostly made up by seniors, families with children, and veterans, is the cost, the location, the transportation, and the quality of food. Some of the grocery stores, they do kind of like what Alana was talking about with the restaurants. They sell the food, but they put the fast food and the sugary items up front where they're first noticeable, and then they put the healthier foods in the back. But with the farmers markets, they try and make sure that we have the fresh vegetables, the fresh fruits, and put the other items that we may want, say maybe a cup of coffee and a muffin or a pastry with, to the side where people can come and get those items through coupons that the city of Boston's mayor's office provides for them at no cost, and they can use them between the months of July to October. So they can get $10, $20, sometimes up to $50 of coupons for them to buy fresh fruits and vegetables from the different farmers markets in and around the city of Boston.
That's great. Thank you, Arnetta.
You're welcome.
I know that I am always tempted by a muffin or, you know, something sweet, chocolate.
Yeah.
And it's a challenge for all of us, I think, as human beings. And what you're describing are some additional challenges that are present when there are not places to easily purchase fresh fruits and vegetables, or they're too expensive. In some cases, there are mobility issues. It's hard for people to get to stores and bring food back. So you're describing one approach to give people some payments, some coupons that are specifically for farmers markets. And that's really a helpful example. And I wanted to now bring up the theme of a loss of a traditional diet. And both Kun Chang and Dr. Sandy Range had some comments on this. Kun, let's go to you first. Could you talk about the impact you've seen in the community that you work with?
Sure. Let's talk about food. We love food. So I remember when I grow up as a kid, eating McDonald's is fancy. Okay, so started more Westernized type of food has a greater influence to all community. People love those kind of Western food instead of traditional food. Like every meal, sometimes we have a big meal. My wife always give some dessert after big meals. Usually this never happen when we grow up as a kids. We we don't eat such as a dessert after big meal. So for always love to have the tate, the cheesecake, all those processed food with the sugar. They say when you put more sugar, you make you sweet, also make you fat too. So I can see that is changing, especially right now in our community. We have more shifting to fast food, processed food, more sugary type of food instead of more traditional fresh meats, fresh fruit like that. So I think that's had a greater impact because the lifestyle also changed. People feel that we love to have more time with the big group as a meal, but after pandemic, a lot of time change. People tend to stay home, order some takeout instead of eating with people, instead of making food on their own. So this is all the changing situation we encounter in our community. So I think that has a greater impact to our diet.
Thank you, Kun. Dr. Sandy, did you want to make any comments about the loss of a traditional diet?
Sorry, I had to unmute here. Yes, thank you
That's okay.
so much. So
We can hear you.
Okay, thank you. The loss of a traditional diet, basically, we have to look at what we have access to in our grocery stores, which is not much as far as healthy food is concerned. As most of us know, over the past 40 years or so, the food supply has become more and more toxic with pesticides, this new appeal thing that they're putting these wax skins over fresh fruits and vegetables, which is not necessary. So we don't know why they're doing it. It's just another chemical, another additive, another toxin that's being added to our foods. We need to make sure that, and even policy-wise, how we can assure that our elders and everybody, for that matter, even children, have access to healthy organic foods and foods that are traditionally, culturally traditional to them. It behooves me. This is a very, very important topic to me around healthy food for everyone. So, it's hard for people to grow their own foods. You can, but it's not going to be enough. So we need to be able to have access to the healthy foods in the grocery stores that people have access to.
Yeah. Thank you.
Yes, thank you.
Thank you, Dr. Sandy. I think, food has so many aspects, and you're addressing some of the important ones. And Jessica, I wonder if you could put in the chat a couple of resources. I think that, food is a way that we express our culture. It's very important that we have access to food that we like, but also that feels like home to us. And Kun and Dr. Sandy are both touching on that. There are a couple of resources that have been made available recently. The Us Against Alzheimer's, in honor of Hispanic Heritage Month, has shared brain healthy recipes for the Latino family kitchen, which Jessica's put in the chat, along with an organization called Old Ways that has heritage diets which follow healthy food recommendations, because we know that not only do the foods have to be healthy, but they have to fit for people culturally. And thank you, Amy, for the shout out to the Dorchester Food Co-op. I'll just say to everyone, please feel free to share your resources in the chat as we go. There are a couple more aspects to food and nutrition that I wanted to touch on with the help of community partners. So Lisa Krinsky, you had mentioned the issue of isolation at mealtimes, and maybe you can explain how that plays out, and then also a resource that's been developed to help with that.
Sure. So we know that LGBTQI plus older adults are 2 to 3 more times more likely to be aging alone without a spouse or partner, without adult children or grandchildren. And so people who are living alone, regardless of age, but particularly we see this with older adults, are less motivated to cook. Unless you just quoted I think it was the Latino family recipe or cookbook or something. That to me, I get a vision of 6 or 7 people and recipes that are large and that produce a lot. And I think it's hard for people who are living alone and those who are aging alone to prepare meals when it's just a meal for yourself. And so when people are eating alone, there's a lack of appetite, there's a lack of willingness to get anything or put it together. It's one of the reasons why we've seen an amazing growth in the LGBTQ plus friendly community meal programs across Massachusetts. We have nearly 30 of them, many of which are part of the Council on Aging networks or the Aging Service Access Point networks. But giving an opportunity for people to come together for healthy, nutritious meals, as well as socialization is really key and crucial for folks.
Thank you very much, Lisa. And if there's a link for the meal program, maybe you could put that in the chat. Lastly, I want to go to Kathy Service, who works with the community of people with intellectual and developmental disabilities, where people are often living in group residences. So there's different dynamics there. Kathy, do you want to share about challenge there?
No, thank you. And I mean, some of the earlier speakers addressed issues for people who continue to live with their family care providers. So all the issues around expenses, access is for those family caregivers. But in group homes, and I was just going to write here, there's issues around time. Many are paid caregivers. They don't have the time. They have other obligations. They're often short-staffed. They may be between 2 and 3 jobs. And I think that's one factor. But in addition, knowledge. People don't know. I mean, seriously, know how to prepare nutritionally sound food. So I think enabling people on what are good recipes, using herbs and other things like that is essential. And it really, the other thing is that, family style dining is promoted and I understand that group eating in a situation, but sometimes people who have intellectual disabilities may have their own food preferences or are on quote special diets. So being able to kind of accommodate all these needs of individuals in a group home setting is really important. But I do think that it really is around education and time and knowledge, because people don't know how to, many of us, have to kind of learn how to cook nutritionally sound foods. It's different. And I do call out that some of these other groups, such as Us Against Alzheimer's and also IA Squared, they have a lot of information for these different groups of people on how to make food that you can eat. And I'm a nurse practitioner and I could write any diet in the world, but if people aren't going to eat it, what good is it? So you have to kind of partner with people and figure out how to make it work for people.
Thank you, Kathy. It's great to see the resources being shared in the chat. Please keep them coming. Paula Garza shared a link to a cookbook that uses only 5 ingredients for many recipes, and they follow the MIND diet, MIND, which is a diet supported by research to be very brain healthy and heart healthy. And I see Arnetta's suggestion of cooking larger portions and then freezing portions, which is a smart thing, and lots of other resources. So please do keep those coming. So I want to shift gears now and talk a little bit about physical activity and what some of the barriers are, but also some of the good approaches and resources you've seen in your community to promote physical activity. So Judith, let's go to you because we haven't heard from you yet. Judith Thermidor, can you talk to us about the importance of providing programming in many languages and how you've seen that play out? around physical activity?
Thank you so much, Beth. Physical activity is a critical part of well-being, brain health, and socialization. So, however, it's very diverse when we address Tai Chi, chair yoga. Some people they like dancing, some people they like biking or hiking, some people they just want to swim or aqua aerobics, or even dancing, some they're ballroom dancing, or that can be Latinos music, salsa. It's very diverse when we talk about physical activity, how to address the growing diverse older adults in Boston, especially. They are very diverse. And I think developing partnerships is the best key with YMCA, BCYF, all existing communities for physical activities. And transportation, I think all of us, sometimes there is a lack of motivation to do physical activities, especially when it's getting cold or raining. But if we provide transportation, and not only transportation, but do it as community, 2 or 3 or 5, 10 people together, especially always think about affordable housing because they don't have enough resources. They don't have most of affordable housing for older adults. They don't have a gymnasium or gym in this building, so they have to go outside. But what is the importance to develop partnerships, especially transportation is the biggest key, and that can play a crucial role about mobility, brain health, and socializations, and you can get a better sleep. We know there is a lot of research, a lot of evidence-based program that we can really understand the impact of physical activities. But once again, that can be very diverse because we have a large, diverse older adults, how we can meet their needs and regardless of culture. And that's what we are doing, connecting with other institutions. Even we do have research as well. Mass General Hospital just conducted research about the impact of physical activities among older adults to increase mobility or maintain their independence.
Thank you, Judith. And I wonder if we could go to Arnetta, because one of your roles is to teach technology skills to older adults. And sometimes when people can't easily get to a place for physical activity in person, there are virtual programs available. Could you talk to us a little bit about how you're able to help people learn to use technology even when they maybe haven't had that experience before?
Yes, Beth. Many seniors, which I teach to, is 55 plus, that have not had experience with computers. They can work their phones better than they can a computer. They're afraid of computers. They're afraid they'll break it and then they'll have to pay for it. But one thing that I found out years ago with Technology Goes Home, they provide a free Chromebook for seniors, families with children, and other learners, where they can get the Chromebook. They just need someone to teach them how to use it. And once they're learning how to open and close and research different sites securely, then they are more than welcome, more than happy to join into any computer class. They can also use their Chromebooks to go on different sites where they can learn, especially with the city of Boston, they can learn how to do different physical activities, different Zoom classes where they can do physical activities at home. Some of the farms in the neighborhood provide physical activity and tell them about specialized cooking to go along with those physical activities through Zoom, so they don't have to leave their home anymore. But if they do want to leave their home, there are a lot of community centers that offer Zoom, Tai Chi, other physical activity programs that are taught by seniors like themselves, so they're not afraid to go to the class thinking that they're going to be the only senior there, and they can learn how to keep their bodies motivated, whether it's walking, sitting in a chair, exercising, or even rowing on a bike or pedal at home. So they're getting more into the process of what the young people are doing on the outside in the parks, and they can do it in the apps in their homes without having to go outside. But if they want to communicate with more seniors their own age, then they can go to the community centers, and they always have programs there to help. And I recently found out at the beginning of this year in April that the center that I'm teaching at Vine Street has a young lady there that has her own physical activities program, and she also does classes in dementia and activities in dementia and Alzheimer's.
Thank you, Arnetta.
You're
I think
welcome.
it's all very encouraging what you're sharing. And maybe we can remember back in the spring of 2020 when we faced the pandemic and we all had to switch so many of the things that we did onto virtual platforms. And I remember there being many questions about whether older adults would be able to do that, and also people living with dementia. And what we've seen is that a lot of people have made this part of their lives thanks to teachers like Arnetta. And I think what you said is so important, Arnetta, that by seeing an older adult as the teacher, it takes away the fear. This is a theme I've been hearing all afternoon, is people need to see someone who they can relate to, and they feel like, yes, this program is for me, this place is for me, I belong here. So that's really important.
One other thing, Beth,
Yeah.
that I wanted to add was transportation. The Age Strong Commission has a van that will take them to their doctor's appointments, but won't take them to programs like the community centers. But the ride has improved, and it will take them to the community centers. So a lot of the students that come to the computer class, they use the ride for transportation. They'll pick them up at home, bring them to the community center for the computer class, and then take them back home. So the transportation issues have improved quite a bit.
That's good to hear. And I think, one of the themes I'm hearing this afternoon is how many issues are interrelated: transportation, social connection, healthy eating, physical activity. If you have all the ingredients together, they really reinforce each other. And on the flip side, if you're missing some of those pieces, it can really make it hard for people to put these brain health techniques into practice.
Yes.
I wanted to go to Tirsa Ramirez, who works as a health navigator and educator at the Latino Health Insurance Program, and ask, Tirsa, when you're working with families in the clinic, is there anything that you find is helpful to encourage physical activity and healthy eating?
Buenas. Sí, muy buenas tardes. Sí, soy educadora de salud y he visto la necesidad que hay en la población latina. Sobre todo trabajo con los latinos y veo la mala educación, y cuando doy las clases de educación, muchos de ellos se quedan sorprendidos y eso les ayuda como a tomar un ritmo diferente. Lo he experimentado en los grupos que tenemos. También capacito por Zoom y presencial, Y he visto el cambio en muchos de ellos, y muchos de ellos se han quedado sorprendidos porque no han visto o no han estudiado anteriormente y cuando se va la sorpresa, cuánto de carbohidratos estaba comiendo, las porciones, etcétera. Y eso pues nos ha ayudado a nosotros, hemos visto el progreso, hay gente que ha bajado de peso y cambios que hemos visto, la gente que tenía la diabetes muy alto también ha bajado. Entonces, todo lo que he aprendido ahora con los doctores que están explicando, me relaciono con lo mismo que nosotros estamos haciendo. Y creo que si nos educamos vamos a tener una larga vida de salud mejor, que es el objetivo. Yo estoy muy contenta de ser parte de este programa porque ayudamos a la comunidad. Gracias.
Thank you, Tirsa. So I think that knowing what we know about brain health, it can motivate people even more to make changes that may be difficult in their diet and physical activity, but the education has to be provided. So thank you, Tirsa, for explaining how you do that in your work. And I know all of you do that in your work. Andrea, I want to see if you have any comments about food and nutrition and physical activity, and then we'll touch on the other two areas.
Thanks, Beth. I think my thought about physical activity and nutrition kind of relates to what's coming next, but I think public health departments have a really important role in helping folks understand that nutrition and physical activity can really be sort of like force multipliers for health. And they're not just good for your brain health, but they're beneficial for managing chronic diseases like hypertension and diabetes. And those are really important and well-researched risk factors for dementia. So I think the theme for me is that nutrition and physical activity has benefits that are overall health benefits, your brain and beyond, which to me is a really important motivation for trying to embrace those things when I can.
Thank you, Andrea. I want to talk about the area of managing chronic health conditions because we know that other health conditions are very connected with the risk of developing dementia. For example, high blood pressure, diabetes, being overweight, some of the other factors that we've talked about around vascular health. And so I'm interested to hear from some of you about what you have seen help in your community and some of the challenges. And when we talked about this before, many of you talked about the difficulty nowadays in finding healthcare providers, that especially during the pandemic, many providers left the field. Meanwhile, we are an aging society, so we need more healthcare resources, and that can be very difficult. But there are specific challenges that some communities have. Lisa Krinsky, I wonder if you would share with us some of the challenges in the LGBTQ plus community and maybe what you've seen is helpful.
Sure, thank you. I think some of what we've seen is just the lack of culturally competent care, and that probably speaks to many of the populations that we're talking about here, whether there's linguistic access, culturally competent care. We see pretty high rates of comorbidities around depression, heart disease, and LGBTQ folks. Also amongst those in our community who are long-term survivors for HIV and AIDS, being able to manage those conditions and understanding the intersection between HIV and aging. These folks are pioneers. No one else lived this long with the disease to know the impact that those will have. Thinking about how all of that impacts brain health is equally important for folks. So thinking about how we're finding providers who can be culturally competent when they're working with folks across the spectrum.
Thank you very much, Lisa. And this brings me to, as we were talking about social connections, there are some common themes here. many of you talked about feelings of fear of being accepted, being listened to. Doris, Dr. Harris, I wonder if you could unmute and talk with us a little bit. We talked about some of the barriers to social connection, and you talked about how sometimes people feel ashamed, embarrassed to connect with healthcare providers or other peers. Could you talk with us a little about what you see in the communities that you serve and what could help?
Yeah, some of the things that I see in the community is the embarrassment and thinking they're the only one who has this situation. Not being able to articulate their questions and thoughts. So they tend to just keep everything to themselves. I found that people who had a client, a relative who had dementia, one particular person, they were embarrassed because this woman was a very highly educated woman, very well known in the community. And they kept her isolated for fear and shame. One of the things is getting out. The Memory Cafe has been very effective in bringing people together to have an understanding that they're not the only one who has this situation, and how can we collectively work together? Sharing of ideas, sharing of thoughts. I have to say that my radio show, Health Matters radio show, is one that gives people information in a non-threatening way. I always get phone calls or questions when I'm out in public about a radio show that I did on dementia or other health conditions, diabetes, high blood pressure. So it's important that we do a lot of things that are culturally related to the wide community that is in the Springfield area, as well as involve other organizations that can help promote it. I like utilizing the churches, and I also am utilizing the NAACP, which is an organization in the Black community that's been around for a long time. People need to hear from people that they trust and look like them.
Absolutely. Thank you, Doris. I appreciate that. And I think it's a theme that I'm hearing a lot this afternoon, is that in order to make changes, especially difficult changes, people need a sense of belonging. And so for all of us who are hoping to support other community members, that's a good area for us to look, is, do people feel really included? And if they don't, what are some of the barriers there that we could remove? You know, through encouraging the full participation of people from a variety of backgrounds, so that everyone can look up and see someone offering a program, leading research, et cetera, who they can identify with, so that we can offer more accessibility in all kinds of ways. So I'm aware that the time has come for us to close this conversation. We had a lot more to say, but I want to give you all a 15-minute break, and I want to make sure we have the full amount of time to hear from Miriam Owens and Faye Bailey, two advocates living with dementia, because you're not going to want to miss a minute of what they have to say. So what I'd like to ask is if the community partners and Andrea DeTore, if you could wave a magic wand and wish for anything from policymakers or community organizations, maybe from age and dementia friendly community movements, what would you like to see changed that would then make it easier for individuals to implement the brain health recommendations? If you could just put your wish list in the chat as we go on break, then everybody can get to see, and I encourage audience members to chime in with your wish list as well.